guess officially the role is CEO and co-founder, but the reality is it's probably more like an orchestrator. I'm kind of that guy who's the conductor in front of a symphony and waving a stick around, and you wonder what is he doing. But I think actually it's about bringing together different pieces of the business. On the one hand, the patient experts themselves, and in the middle, our team, because we bring things from the patient experts, we connect it with the other side, which are the clients, and all pieces have to work together. And when they do, it's a beautiful symphony. And when it doesn't, it kind of falls apart. But you know it right away, and there's only one person to blame. That's probably me. So it's that unique role, which orchestration. What do our patient experts do, and what makes things better about having patient experts? I think the word patient expert is just a catch-all that we use for different types of individuals that work in healthcare with us, all with lived experience. That's the unique sort of commonality that everybody has. But the reality is that everybody has their own unique skills. And we look at people not just as patients, but as the individual. Everybody has some unique skills. And we have, as an example, somebody who was a surgeon and then got breast cancer. We have somebody who worked in IT all his life and then got colorectal cancer. And these kinds of things are the skills that they bring to any project. So we recognize that, and then we involve them in different ways. And we have people who are co-researchers, people who are analysts, people who are writers, and then also patient at the same time. And that's the beauty of bringing the whole human into projects, because everybody can contribute not just their lived knowledge, but also their skills. Where are patient experts underused and misunderstood? I think that's actually relates just to what I said about people bringing their whole selves to a project. And we tend to look at patients and patient experts as first and foremost somebody living with a disease. That's underusing them, because that's only one dimension of who they are and the communities they represent. So underrepresentation of actually the whole human is where they're underused. And nobody's really figured out how to bring that fully in, especially into healthcare, pharma, biotechnology, and diagnostics. But we try to actually make that happen. And I think the way that we do it is we bring people as part of the team. So a patient expert is underused as a team member, somebody that you work with during a project or on your business challenges. And that's what we're trying to change. And that's the business model behind Merakoi. Moments where patient insights have changed direction of work. I think actually every project, every good project, when the symphony comes together, should have multiple moments like this. And it's really becomes kind of what we call aha moments that the client, the patients themselves also recognize. And a good project will have several. But as an example, I would go back to the very first project that we had, which was, I think, over 8 years ago in a clinical trial, where a patient joined the clinical trial team for a number of sessions and told their story, but also helped the team sort of look at what they were doing, their jobs, and how the trial should be constructed for other patients. And what changed was every single person in that room who had a different function, like the statistician, the biomarkers lead, the medical lead, the clinical ops lead, they all changed the way they worked based on what that one individual said. That changed the whole direction of the trial, the way that the protocols were written, the way that the investigator meetings were conducted, and ultimately the way that new materials and experiences were generated for that trial. And it all came down to that one starting point with one patient telling about how they would like to experience the trial. That's the kind of moment that we want to recreate in every project. One thing that a client can do to save pain later, basically when we start a project. And I think the number one thing is to tell us what business problem you're trying to solve. Tell us what questions you're trying to answer. Sometimes it's not obvious, and sometimes it's sort of discovered at the end of the project, and that's a shame, because if we know upfront what the real business challenge it is, then that changes how we run the project, the methodology, the questions we ask, and even the types of patients that we bring in, the types of patient experts that join the project are all based on that. So a good project, we know exactly what the business challenge is from the very first day. my go-to snack or drink to stay sharp through the whole day. It's easy. It's dark chocolate. I've got some right here actually on the desk. They're sort of lined up, ready to be eaten. It has to be 70% or more. That counts as dark chocolate in my mind. Anything below is candy. But dark chocolate has, I've researched this, it has scientifically proven benefits, health benefits and cognitive benefits. So I know it works. It's my go-to snack.
Tap that button.